have it or you don't. It's possible for everybody to get through this nursing program, everybody. But not all of you will be awesome nurses. The people who become awesome nurses are the people who incorporate into their everyday behaviors all of the caring things that they show to their patients. Okay? As I told you, I think I told you, nursing has been the love of my life except for my kids. I've loved every minute of my nursing profession. I love being able to help people get better, and if I can't help them be better, I love helping them have a comfortable death. I don't look at that as a failure. It is part of the natural life cycle. So that art piece is based on compassion and respect and dignity for not only your patient but their family. So we talked about the American Nurses Association. They're the ones that have a code of ethics that is sort of the boundaries for our practice. Again, if you have time, ANA, and look at Nursing Code of Ethics in there, it tells you what is responsible for you. And then they have standards for various different areas in nursing that will tell you exactly what your professional responsibilities are to your patient. And we'll be talking about some of those. As I say, some of those things we will do in seminars. Why does this one not want to? There we go. So there are some historical perspectives that you need to know about nursing. We'll talk about some of those. We'll talk about some of the influential people. Certainly nursing is affected by social and political policy. We are going to be undergoing a huge change in what we are doing in the healthcare world with Obamacare. It's going to be very different. I suspect that the people that are going to make it work are nurses. We already do not have enough primary care available, and Obamacare assumes that there is adequate primary care. Just recently, New York State has added legislation that after 2 years of clinical practice, a nurse practitioner can independently practice without a physician. Okay? So I am telling you, if you people want to have a good career, keep going to school and get your NP, because you are going to be able to open up a clinic to take care of people. And as far as I'm concerned, I think it should be nurse practitioners who are taking care of elderly people, because I can tell you pretty much 100% of the physicians don't get them, and nurses do. And there are going to be more of us, and we're going to want to keep them home. I am desperate for somebody to come to my mother's house to see her. It is too hard to take her out anymore. But do you think I can find a primary care person who will come to her house? No. So she kind of doesn't get that care anymore.
Doesn't Dr. Way do some home?
He does, but he's not going to come from up there where I live. Yes, he does. Some of those doctors do. Dr. Way has been a notorious one for going to see the people in the Adirondacks off on dirt roads.
Well,
Some
he knows
of whom
where
are
all the
illiterate.
roads are too. That kind
Right.
of
Some of those people who are very old and illiterate, and yes, he does take care of them. But that's a pretty sad statement. So, truly, I think nurses, we are the ones that really respond to the needs of the patients. We will see that is going to happen. We should actively participate in policy making. Not necessarily on the federal level, but within your own organization. When somebody wants to form a committee to look at something and come up with a new policy, don't say, no, I don't want to participate. It is part of your professional responsibility. And then, if you don't participate in it, you should not be complaining about whatever the policy is. Deal with it. You have to be an active participant in it. Nurses need to be flexible. If you are not a flexible person, get out of here. Because stuff changes every day. Every day stuff changes in this profession. Every day you will have to learn something new. Every day a procedure will change. Every day there is a new medication. You have to be a lifelong learner. You have to be. Because you're going to learn something new every single day. You have to make clinical judgments. We talked about critical thinking. You have to be able to be a critical thinker. You have to be able to see the gray, because everything is not black and white in this profession. There are grays. There are in-betweens, and you have to be able to think those things through. You have to maintain your knowledge. So you have to be a reader. You have to watch the news. I'm telling the students all the time, you can't flip through those drug commercials on television. Students come back to me after they've taken their state boards all the time and say, I wouldn't have known that medication except I saw the commercial on television. Because often that's how you're going to learn about a new med soon, is on the media, which is sad, but that's the way it is. So we are going to provide care according to standards of practice and code of ethics. Now, the first nurse was Florence Nightingale. There was a period of time in our nursing history where we did not really appreciate Florence Nightingale. There were kind of a group of radicals who didn't appreciate it. But she was in the Crimea War, and she dealt with battlefield conditions that were terrible, where she saw her patients fall to infections, to illnesses like dysentery, and where she saw a huge mortality. And she was one of the first nurses to recognize that one of our major responsibilities of a nurse is to prevent infection and to maintain adequate nutrition and cleanliness for our patients. And do we not still do that? We absolutely do. You know, in the 21st century, we are looking at pain management and nutrition management and all kinds of things, care of elderly patients, care of people all across the lifespan. But essentially, a lot of what we do goes right back to Florence. We'll be talking about some other people who historically have, been very prominent in nursing. As I said, Florence Nightingale was really our first epidemiologist. She figured out that cleanliness and not washing hands was one of the ways that her patients caught things. She organized the first school of nursing. She tried to improve the sanitation at battlefield hospitals. It was just deplorable, and that's why they died of other illnesses. And really everything we do today goes back to her. Her first nursing school was established in 1860, and she's often known as the lady with the lamp. You'll see that, a lot of media that deals with nursing will show the lamp with a candle in it, and that's considered to be the Florence Nightingale lamp. Nursing grew in the United States also at about the same time, 1861 to 1865. Clara Barton was our version of Florence Nightingale, and she worked in the fields in the Civil War, and she was the one who established the American Red Cross. Dorothea Dix, she was the supervisor of the female nurses in the Union Army, another important historical person. Mother Bickerdike organized the ambulance service during the Civil War and supervised the nurses. They went around after the battle had moved on to somebody else and picked up those people that were left there to die by their colleagues, of all sorts of horrible wounds. When I think of her, I think about, how many of you have seen Gone with the Wind? Has everybody seen Gone with the Wind? And that picture of Atlanta when it was burning, and the picture of the railroad yard with bodies everywhere, that's what I think about when I think of her. Harriet Tubman was very prominent in the Underground Railroad. She was a nurse. She tried to help get the slaves out of the South to the North where they would be safe. Mary Mahoney was the first professionally educated African-American nurse. And she was one of the first people that tried to get us to recognize that there were difficulties between cultures and that nurses should not participate in that. There should be no cultural barriers or divides within nursing, and that we needed to take care of people regardless of what their race, their color, their background, or their religion. Isabel Hampton Robb, she helped found the American Nurses Association in 1911. You know, and she was influential in helping us establish, you know, codes for professional nursing practice. You also will hear a little bit about Lillian Wald and Mary Brewster. They established the Henry Street settlement that was one of the first nursing clinics in the country, where they provided care to indigent people living on the street, some of them, or very, very poor. You know, so they were also very influential in helping to get that organization going, and I believe that is still operating. So, in the 20th century, we started to move toward, you know, a more scientific base. As the world changed to a more scientific base, so did nursing. And we started to look at nursing research about, you know, looking at what things impacted our patients' outcomes in a positive way. Today, that is called evidence-based practice. You know, incorporating some research, and some of it's really simple. Doesn't have to be complicated, but looking for things that are going to work to help our patients. 1901 was the year the Army Nurse Corps was established. In 1906, Mary Adelaide Nutting was the first nursing education professor at Columbia University. So that is, you know, one of the oldest universities of nursing in the country. Let's see, 1908 we had the Navy Nurse Corps. 1920 to 23 they looked at how we were educating nurses. You know, and much of the education of nurses that was done in the early years focused on housekeeping. Okay, and again that goes directly back to Florence Nightingale, because the cleaner the environment, the better the patients did. You know, and that's why I say I consider that still to be a part of nursing if there's nobody else there to do it. And, you know, what kinds of things hygiene did for patients, good hygiene for the patients. And then how it was best to educate nurses. You know, in early nursing education, the education was done on the job. Okay, you went. You know, when I became a nurse, the first nursing school I went to was a 3-year nurse, and you were essentially the slaves of the nursing school, truly. You know, they gave you some basics and then they threw you to the wind, and you went out and you took care of patients. And often staffing on a patient care unit would be a senior nurse and a lot of students working themselves up through the ranks, and that would be it for the nurses. Okay? That was back in the 60s. You got a wonderful education, but you flew by the seat of your pants. It was scary. You know, in, I think the first 2-year nursing school opened up in 1961. And that's when we really started to recognize that probably that kind of education needed to be done in an academic setting with clinical, rather than a little academics and a lot of clinical. That's when things really started to shift. And then during the 40s and 50s, we started to